Welcome to Health+Tech, the podcast where we explore the law that applies at the intersection of healthcare and technology. Hosted by McGuire Woods, episodes feature healthcare innovators and updates on the laws that apply to digital health businesses.
Welcome to the Health+Tech podcast. I'm Kristen McDermott Woodrum, a healthcare partner in the Atlanta office of McGuire Woods. I'm joined by my partner, Holly Buckley, who's based in Chicago and chairs the McGuire Woods Healthcare Department. Holly and I lead the McGuire Woods Digital Health, Technology, and Innovation practice and are hosts of this Health+Tech podcast. And we're excited to announce that we will be hosting a digital health dinner and keynote on Wednesday, September 27th in Charlotte. It'll be held the night before our annual Healthcare Financing Growth Conference. Our keynote speakers this year will be Dr. Zeev Neuwirth, Chief Clinical Executive for Care Transformation at Atrium Health Advocate, and Todd Dunn, who's the Vice President of Enterprise Innovation at Advocate Health. We hope to see you there. Save the date. More information to come, and please feel free to reach out if you'd like some details in advance. Today, we are excited to welcome to the podcast Cyril Philip. Cyril is the Vice President of Digital Ventures at Bon Secours Mercy Health. In his role, he looks to invest in innovative healthcare technology companies, which can add value to the broader Bon Secours Mercy Health vision. Prior to joining Bon Secours Mercy Health, Cyril spent 7 years building the investment platform at Providence Ventures, the $300 million venture fund of Providence. During his tenure at Providence Ventures, Cyril completed over 30 financing transactions and 3 exits in the healthcare technology, tech-enabled services, and digital health sectors. Prior to Providence Ventures, Cyril was a middle market private equity investor at Halyard Capital, and he started his career at UBS Investment Bank and their global healthcare group. Cyril graduated from Carnegie Mellon University's Tupper School of Business. He's currently based in Seattle and is from New York City. Welcome, Cyril. So tell us about yourself. You have an interesting career trajectory, having spent time as an investment banker, then middle market PE, and now a nonprofit health system. Tell us about this evolution.
Yeah, so first off, Kristen and Holly, really appreciate the opportunity to be on the podcast and appreciate the kind words and introduction. It's interesting because it's definitely been a journey over the last 14 years for me in my career. I started out in investment banking, as you alluded to, and one of the first things I did after I graduated was they gave us the opportunity to pick an industry group at UBS to join, and I joined the healthcare group because I felt that was going to be an industry that's going to experience a lot of change, and I wasn't wrong on that front. In banking during my time there, it was kind of the period of time where there was a lot of the payer mergers happening. So Anthem's predecessor, WellPoint, was acquiring companies. Cigna was acquiring smaller health plans, and I think that kind of alluded to just the beginning of a significant amount of shift in the healthcare industry overall. And it was great to be a part of a lot of those transactions, albeit in a junior capacity. When I made the move over to the investment side in private equity, I went to a fund that was actually a little bit outside of healthcare. They did investments in media and telecommunications type companies. And while that was interesting in of itself, I did miss the healthcare bug and the novel dynamics of the healthcare industry overall. Then about 8 years ago, I had the chance to help stand up the Providence Ventures investment fund. So Providence Ventures is the venture fund for Providence, a large West Coast health system. I moved from New York, where I lived all my life, over to Seattle 8 years ago and helped start up what was at the time one of the first true strategic hospital-focused venture funds. And it really was, when I joined, an idea of sorts. It was an announcement from our executive leadership at Providence that we were going to be investing in companies that were transformative in healthcare and partnering with our health system to drive change. And a lot of the work that I did at Providence early on was essentially bringing that idea to life. And we did. We eventually had 2 funds totaling $300 million, invested in over 30 companies. And it really was also my first exposure to the not-for-profit healthcare and the healthcare system landscape. And then about a year ago, I made the decision to leave Providence and start the next chapter of my career at Bon Secours Mercy Health, where the team was looking for somebody who had investment experience in the not-for-profit space, and essentially could replicate the success that we had at Providence at their system and bring some of the learnings that they had. And that's a big part of my role, is helping stand up an investment function here at Bon Secours, and leveraging a lot of the learnings that I've had from banking through the non-for-profit startup healthcare fund space at Providence to Bon Secours.
It's very fascinating. Could you tell us a little more about your role at Bon Secours Mercy Health and the vision for Bon Secours Mercy Health Digital Ventures?
Yeah. So my main role at Bon Secours is to source, diligence, and complete direct equity investments in innovative companies that make both financial and strategic sense for the health system. My role is a little bit beyond that. So beyond just the direct investments, I also help with some larger acquisition opportunities in the digital health space, help with managing some of the joint ventures that we have in the system, as well as helping with what we're calling at Bon Secours Mercy Health, Accrete Health Partners. Accrete Health Partners is essentially our digital health subsidiary entity at Bon Secours Mercy Health. It's a strategic holding company that holds and houses several assets, both wholly owned and investments and joint ventures that are really leading digital health products and services. And so the point of what we're doing with Accrete is that it goes beyond just direct investments. So at Providence, a lot of what I did was direct investing and investing in companies that were helping the system. What we're doing at Bon Secours is we're doing that investment. We're also building a portfolio of best of breed companies that work better together. And one of the key aspects of our vision is that all of our portfolio companies can cross-sell with each other. They are aligned. There's no sort of competitive edge between them. And we as a health system can go out to partner health systems, to other organizations, and say, hey, we have a suite of products that we've invested in and we've partnered in deeply that have shown strong results in our health system. And we're willing to kind of bring those to you as kind of a suite of options, and you can pick and choose which ones you'd want to adopt. But these have worked well together for us, and they can work well together for you as well. So that's the broader vision. I will say we're only about a year or so into that strategy, and so a lot of things are in flux. But that's kind of the broader vision that we're shooting towards.
Cyril, I have a follow-up question. You mentioned the desire to source companies that are for the benefit of Bon Secours Health System, but then you also mentioned the idea of taking these products to partner health systems, obviously to kind of sell them the solutions as well. How much of the vision is focused on serving your own system versus the commercialization of these products to other systems?
That's a great question, Holly. I think when we look at it, we want to have investments in companies that first serve our system and prove out the value in our system, and then bring those proven values out to other health systems. And then I think if you look at it, though, a little bit more deeply, if a company is able to provide that value to Bon Secours, they probably have added value to other health systems as well. So we're not always looking for companies that have not done anything before. We're looking for proven technologies. But ultimately, our goal is that we want these investments to prove value to us, and then we can sell that proven value to other health systems.
That makes sense. Do you want to highlight any successes or any solutions you see promising?
Yeah, so I would say from the Bon Secours side, it's pretty early on in my tenure here. But one of the things that I'm proud of that we've accomplished here at Bon Secours in the kind of year and a half that I've been here is we've created a much stronger investment review process. One of the pitfalls that a lot of health system strategic funds have is that sometimes they can be a little too eager to invest and move forward in investments without really taking a deeper look from a strategic and financial perspective. if you look out in the landscape, there are a lot of investments that make strategic sense, but don't really make financial sense, and vice versa. So what we've done at Bon Secours and partner with leadership along the digital side as well as broadly at Bon Secours is to develop a clear set of investment criteria, which really ensures a couple of things. One thing is we look at every investment we make from a financial perspective to ensure that there's a sound financial basis to these companies. And I partner with our internal finance team at Bon Secours as well as with external consultants to really do that diligence and ensure that the companies we're investing in can generate return down the line. Second is we try to invest in companies where there's I'd like to say an equivalent level of investment to strategic value. So for example, if we make a $5 million investment in a company, we'd like to see an equivalent path to a $5 million strategic partnership or potential revenue generation with said company. And then lastly, just hitting back on my earlier point, every investment we do, we need to make sure that they kind of can work together and that they're not competitive and they're not going to be competitive at least in the short term. And that, again, goes back to the broader vision that we can cross-sell all of these solutions together and build an accretive portfolio of sorts. So that's kind of the early success, I would say. It's being proven out with some of the investment opportunities we're looking at right now that at some point in maybe a future podcast, I could talk about these when they're public, but it's something that I'm starting to see bear fruit early on in some of the work that we're doing and the early investments that we're making. And we hope that kind of in the next year or so, we'll have some case studies that'll show that value.
That's excellent. Thank you. So I'm kind of fascinated by your personal career trajectory and your move from the for-profit sector to the nonprofit sector. And I'm just curious, what have you enjoyed the most about the transition, and what are maybe some areas that you've had to adapt?
Yeah, so maybe I'll start with kind of the areas I'd have to adapt in. And I want to preface it that there are a lot of challenges with investing within non-for-profit health systems. I think foremost is it's a much more limited scope of investment opportunities. As I said before, we're limiting our investment scope to companies that really see a strong opportunity to expand the commercial relationship, but that has that strong financial base and then has kind of that alignment with the other portfolio companies. But if you look at other health system venture funds like Providence, like the others that are out there, they have a similar type of criteria that somewhat limits opportunities, especially with companies that are seed or early stage. Because again, we want to work with companies that have the ability to service a health system as large as Bon Secours or large as these other health systems. And most of the time, seed and early stage companies don't really meet that criteria. And so we end up missing out on a lot of the very front end of the innovation spectrum as a result of that. That being said, I think one of the key benefits of working with a health system venture fund is that we really could move the needle when it comes to commercial and business development growth for our portfolio companies in a way that, frankly, traditional investors aren't able to do. And this goes to kind of the broader strategy that we have at Bon Secours, which is building kind of that unified portfolio. It goes to some of the work that we're doing within, or some of the work that I did at Providence, which was working with companies that can really or helping to spread the word around companies that are really adding value to our system and being kind of that cheerleader of sorts with respect to these companies. And it goes a long way when a customer is shouting from the rooftops versus kind of an investor going out there and shouting from the rooftops. And I've seen that impact that can have on young companies and earlier stage or mid-stage companies, in that having kind of that anchor investor / strategic partner can really make or break these companies in a way that can't really be done if you're a traditional investor or if you're kind of a smaller seed investor.
Yeah, just fascinating. Thank you for sharing that. And are you seeing an increase or a decrease in interest from health systems in both investments in innovation, in forming innovation funds, in participating in some of the more established funds where hospitals and health systems can be LPs? What are you attributing the trend to?
Yeah, that's a great question, Holly. One of the things that's a little bit, I'd say, disappointing for me personally, just having been in non-profit health systems for 8 years, is that I've been seeing a little bit of a pullback from the interest from health systems when it comes to innovation and investments. And a lot of that has been driven by financial challenges. Health systems over the last 3 or so years have had kind of the dual impact of COVID shutdowns and COVID care requirements, as well as rising labor costs. And what that ends up resulting in is a significant, I'd say, short-sighted view for a lot of health systems where they've just been struggling to stay afloat. And when capital dollars are scarce, investing and putting capital into companies that may not necessarily generate a return in 3-4 years, that's a tough pill to swallow for a lot of health systems. And what that's resulted in is health systems paring back that innovation and investment spend, and rightfully so. I mean, the number one role for health systems is to provide care for their patients, and in order to provide care, if they have to pull back on some of this innovation spend, I completely understand. But I do believe there needs to be some level of investment. Maybe it's not necessarily dollars, but maybe it's time, maybe it's partnership, thought leadership with health systems into new technologies. And so even though from a bottom line perspective, it may hurt to put in money into innovative companies, I think there are many opportunities for health systems to continue to be part of that ecosystem, whether it is through partnering with other health systems who are doing investments, or through partnering with industry organizations, or just kind of getting the word out around what are their key needs that these health systems are facing. And so, although I am seeing a little bit of a decrease in it, I'm hoping that, over the next few years that kind of goes away and we go back to how things were back in 2018, 2017, where health systems are out and in the market and making their voices heard in the innovation ecosystem.
So if there was someone listening from a hospital or health system who is currently not doing any innovation type investing, what would you recommend as kind of initial first steps towards moving in that direction in terms of either communities or contacts that may be helpful?
Yeah, so that's a great question, Holly. I think in my view, one of the first things that those health system leaders can do is really be out there at innovative conferences. And I know your team hosts a conference, and there's several other large healthcare innovation conferences that are out there. I think it's important to be there. I've been to a couple of these out over the last several years, or probably more than a couple, now that I think about it. But a lot of times I don't really see that many health system execs there at these conferences. They tend to be more payers. Like, I've seen a lot of payers, I've seen a lot of retail folks and tech folks and a lot of startups. But from the health system side, whenever I kind of go to these conferences, they're like, oh, wow, you're from a health system. Like, how could we sell into you guys? Like, how can we create a product that's valuable? And I think just being out there in the market, being exposed to these type of companies and the innovations that are out there, in and of itself is a really valuable tool for health systems, and it's an inexpensive way to go about that.
That's great advice and great point, Cyril. Are there areas where you see health system investments growing, and are there areas where health systems need to invest to survive and thrive in today's market?
Thanks, Kristen. So in terms of areas where I see a lot of growth, there are two that really come to mind. One is robotic process automation, or RPA. If you think about just the workflows that happen in health systems, both on the clinical side and then the operational side, and areas such as billing, clinical documentation, supply chain, and others. There's a lot of, I like to say, like busy work of sorts that clinicians and operators have to do that aren't really very complex type processes, but just are things that have to be done specifically on the billing side, where it's kind of reviewing a claim, like adding some notes to said claim, and then cleaning it up, and then kind of sending it out to the next person. And RPA represents an opportunity for health systems to leverage machine learning and artificial intelligence to really improve that workflow and improve efficiency, which in the days of rising labor costs, as I alluded to earlier, is critical to kind of the success of health systems. And we're seeing a lot of interest of that within Bon Secours itself, seeing that a lot of other health systems looking for solutions that are out there. I think the technology is still a few years out to getting to a point where it can really make a difference, but it's worth exploring. And then the second area is one that I think you'll hear from a lot of other traditional investors, which is generative AI. So leveraging large language models to really help improve process flow and improve kind of the day-to-day lives of patients and providers. I look at that as kind of a key change agent, because there are things from the RPA perspective which are very, like our RPA, I like to think about as very much like A plus B equals C, less so about kind of thinking about things or responding to things, versus generative AI is one step above that of, hey, like the average clinician these days has to spend at least 1 hour per day answering Epic MyChart messages. If there's a way for them to leverage generative AI or large language model solutions to kind of fill in a lot of the blanks and help them reach out to patients more efficiently, that's a win-win for patients and a win-win for providers. And I think that's a space that I look at more in kind of the 3 to 5 year time frame versus kind of the next 1 to 2 years. But like I also look at a place where health systems should be paying attention in order to really grow into the next stage.
Yeah, thank you. Those are exciting potential solutions for really real pain points for health systems. Switching gears a little, how do you think health systems should use investments to compete against rising competitive threats, such as the retail tech players, Amazon, payers, and just other disruptors changing the way healthcare is delivered and paid for?
Yeah, that's a good question. But when I think about it, health systems, as I mentioned earlier, they're struggling from cash scarce environment, where there's been cuts in innovation work, cuts in investment, and unfortunately, retail and technology players, as well as the payers out in the market, are somewhat immune to that. Tech has suffered a little bit lately with kind of some stock market declines, but they continue to invest in healthcare, as you're seeing Amazon and other players continuing to launch new technologies in that realm. From the retail side, how health systems could compete is, from the retail side, they're focusing on providing care that's easier and faster than traditional legacy systems. If you look at Amazon's acquisition of One Medical has been as popular as it has been because it provides access to care in a way that is consumer centric. Meaning, if you sign up for One Medical today, you can see a provider today, versus with a lot of health systems, if you want to see a provider, sometimes it's a week or a couple of weeks just to get an appointment. So what health systems can do is they can invest in access solutions to provide that access to their patients. And I think one area in particular that retail and tech have fell behind in is where health systems are strong, which is specialty care. So health systems have the specialists either employed or affiliated, and they have kind of that critical resource out in the marketplace. But for many folks and many health systems, including Bon Secours, including Providence, it's very hard to get access to a specialist. Like, you can't just schedule it online. You have to go through decision trees. You have to go through several phone calls just to get an appointment with a specialist. And I think one thing that health systems can do is invest in access solutions geared towards the specialist provider so that they can provide patients with said access. And essentially that could enable them to subvert the retail players, which are, they understand that that's where the money is as well, and they're going to be moving into that. And so the faster the health systems can move on that and kind of solidify that supply, the better. And then the last thing, just on the payer side, payers, they've had kind of the opposite in COVID, where they've grown their cash reserve. They've kind of increased their ability to acquire other providers and expand their influence. And for health systems, the main solution there is we have to continue to embrace value-based care arrangements that provide some revenue split for health systems on the delivery of care and on the incentives as a result of that. And I think that's something that's been trumpeted for as long as I've been in healthcare almost. And so, I think that's definitely something that needs to continue to grow and expand over the next decade, or health systems will continue to fall behind their competitors.
That's fantastic. Final question, Cyril. What are you most excited about in the next 5 years, and where are you going to be focusing?
One of the things that I'm most excited about in 5 years is honestly just seeing how the market evolves. A lot of health systems, as I mentioned throughout this conversation, are struggling, and they're going to need to, there may be a breaking point where a lot of them end up being acquired or consolidated and being acquired by other or by payers. And so for me, what I'm most excited about for the next 5 years is really what the world is going to look like for healthcare, because I'm an investor. I like to invest in the future, but for me today, if I look out there, I'm really wondering how will payers and providers interact in the future? How will these retail players really move into healthcare? Will they abandon healthcare like a couple of them have had done in the last several years, or will they double down and move forward? And so for me, what's I'm most excited is just seeing how the healthcare landscape will change, because I know it's going to change, because there are levers out there from the cash standpoint, from the broader economy standpoint, that are forcing change. And for me, having been in the healthcare industry for about 15 years now, I've seen a lot of change, and I'm excited to see more change in the future here. And I think that's the most exciting thing for me.
Thanks, Cyril. I mean, I think you work at just such a fascinating intersection, and it's really been great to hear about both what you've been focusing on and your thoughts on the market. We really appreciate you joining us. Do you want to let our listeners know where they can reach you if they want?
You could feel free to reach out to me on LinkedIn. I don't have my exact address out there, but I'm sure it can be provided in the description of the podcast. LinkedIn is the best way to reach out to me. You can find me quickly on there. And looking forward to learning more about any sort of innovative solutions that you have. If you're a healthcare provider and you're looking for advice around kind of the investment space and innovation space, always happy to connect. And same goes for any sort of investors out there, always happy to connect and trade ideas on what I'm seeing out in the market.
Great. Cyril, thank you so much. Again, this is Cyril Philip, who's the Vice President of Digital Ventures at Bon Secours Mercy Health. And thank you to my co-host, Kristen McDermott Woodrum. This is the McGuire Woods Health and Tech podcast. I hope you all have a great day. Thank you.